And in the coming days, many counties are preparing to receive their first rounds of vaccine.
Joining us live to talk about their vaccine plan is Clark County Public Health Officer Dr. Steve Krager. Thanks so much for joining us, Doctor.
Thanks for having me.
Yeah, so first tell us, have any vaccines arrived yet in Clark County?
We are expecting shipments today of vaccines, so not yet.
Okay, how many doses are you expecting in this first round of the rollout here?
Yeah, we're expecting 3,900 doses this week, with up to 9,000 in the next couple weeks.
Okay, and so then what is the plan? How do you plan to then distribute those and get them out to the people who need them?
Absolutely. So the state of Washington has, kind of the most control over how it's distributed, but we're involved with our healthcare partners. The first shipment is going to Peace Health Southwest, and they're kind of dividing among their staff and then among other kind of clinics and hospitals in the area as well. The priorities are high-risk medical workers, so those people that are taking care of COVID-19 patients or in other high-risk situations. And then secondly is, people living and working in long-term care facilities. So those at highest risk for kind of severe illness. Those are our two highest priorities. Those are the people we want to get vaccinated first to protect the highest risk people, as well as protect our healthcare system.
Yeah, I think there's been so much talk about how this rollout's going to happen and who's first in line. How long until the average person could expect to get a vaccine? I mean, we're talking about potentially millions of people in line in front of you.
Yeah, that's a great question, and I think honestly, it's on my mind. It's on a lot of people's minds. I think we're hoping within the next few months. I think by mid next year is a reasonable goal that anyone who wants the vaccine can get it. Honestly, I hope it's sooner, but we don't. I don't want to give people false hope. But this is going to be, it's going to be a phased approach. We're going to be getting shipments kind of weekly, and this is hopefully those shipments will increase as time goes on, and when we'll be able to kind of open up for more people, but it's going to be restricted at first.
Okay, well, I know Washington State is running ads right now trying to ease any fears about the vaccine. What would you say to people who are concerned about getting this vaccination?
Yeah, I understand those fears. This is a quicker process than we've seen for a vaccine before, but we've never been in a pandemic like this before, at least in the modern kind of scientific era. What I would say to people is that a lot of competent scientists have looked at the data, and it's safe. We have good data on this vaccine. We have good data. It's looking like on the Moderna vaccine, and that it's effective and it's safe. The reason it's been so fast is a couple of reasons. It's a new type of vaccine that allows kind of for faster development. And then at the same time, they decided to manufacture the vaccine before it was approved. So in most cases, you wait for it for approval, and then you start manufacturing large quantities. They've already manufactured large quantities, so they have them on hand. So I'm going to get the vaccine. I'm going to encourage everyone that I know possible to get the vaccine as soon as possible.
Yeah, it's a gamble that is certainly starting to pay off now. So Dr. Krager, I'm curious, there's been so much focus on how this vaccine is being stored, these super cold temperatures needed to transport it and keep it in locations. How exactly is it then being administered to people? Take us from the deep freeze to it actually being injected in someone's arm.
Yeah, well, it kind of depends on where you're at. So there's a lot of logistical challenges. You are able to transport this Pfizer vaccine. You're able to store it in a refrigerator for 5 days. So, if you move it somewhere that just has a refrigerator, as long as you get those doses within people in 5 days, it's okay. So that storage requirement isn't absolute. There's also ways to kind of keep it cold with dry ice. But yeah, I mean, if it's hanging out in a freezer at Peace Health Southwest and you're a Peace Health Southwest employee, they're going to have, vaccine clinics. that are going to vaccinate large numbers of people over the next few days. And then other shipments of vaccine are going to go to other places, and they're going to set up vaccine clinics as well. The logistics of that are, honestly, they're still being worked out exactly, because we didn't know until this week exactly how many doses we were going to get. So we're working very hard to try to plan all of that.
All right. Well, thank you so much for joining us this morning, Dr. Krager, and we wish you the best in that vaccine rollout.
Thank you so much.